So that's a really hard question, because that's highly dependent on the severity of the pandemic in one specific region. The way, for example, Seattle region in the US or Italy, which both has been really touched pretty hard by the pandemic, this situation is completely different than some areas, for example, in the south of US, south of France, where the pandemic was less a problem. I would say that in a lot of circumstances where we are in a situation where the AML treatment is given in a curative approach, the recommendation are really not to change anything on the management, provided that there's a big difference on how we're going to think about the treatment of a patient that is COVID negative in the era of the pandemic. And in that case, that's what I was mentioning. We're really going to go ahead and make not any single change in the way we're considering treatment, versus what we can do for a patient that is COVID positive and symptomatic with a newly diagnosis of AML, for example, because the situation is obviously definitely more dramatic. The COVID situation may be precluding any treatment of the AML. In the context of non-intensive treatment, there's a bit more subjectivity in the interpretation, and that's really almost an individual risk-based assessment. In the majority of patients that would consider, for example, for epigenetics-based therapy, such as hypomethylating agent, for example, and combination of hypomethylating agent, the consensus is really to try to move forward with this treatment as long as considered reasonable from the local situation. There's a few cases where potentially some lower intensity treatment with, for example, IDH inhibitor that are just oral medication to take home, or potentially FLT3 inhibitor may be appropriate in this context, but that's a minority of the patient. Once again, even in these circumstances, we do not approach the management of the situation the same way in the context of a COVID negative patient and a COVID positive patient, with obviously the need to potentially delay some initiation of treatment if possible for patients with COVID positivity.